Hey everybody, this is Dr. Vince from FTR in Joliet, your local physical therapist. Today I'm going to describe a test called the Modified CTSIB, otherwise known as the CTSIB. You can understand why they call it CTSIB. Okay. What this test does is it tests for a vestibular dysfunction. You've seen the trend here. I'm doing a lot of vestibular videos today. With this test, we'll have a patient stand in a comfortable position, feet roughly shoulder width apart, and they'll stand with their eyes open. Ideally, there's not going to be too many balance limitations in this position. If there are, you definitely need to be seen by a physical therapist or a physician. Okay. Next thing that we'll do is we'll have you do the same test with your eyes closed. Patients who have a vestibular dysfunction may feel more unsteady with their eyes closed because we're removing one of the three systems that patients need in order to maintain their balance. The three systems that are needed: visual system, vestibular system, somatosensory system. Big words, okay? Eyes, visual. Vestibular is this little organ that sits behind your eyes, okay? It measures movement. Okay? I feel like the Wizard of Oz. Measures movement. The last one is called your somatosensory system. And this is the communication between your joints, your muscles, your soft tissue, and your brain. For instance, I can close my eyes and find my mouth. Trust me, if you look at me from the side, you can see I can find my mouth every minute of the day. So this is the second step, is eyes closed, feet underneath you. The third step is standing on some sort of soft, compliant surface, such as this, or trampoline, some sort of foam pad, egg crate, doesn't matter. With that, only do this test in the presence of a physical therapist or a physician, because if you do have a vestibular dysfunction, you will most likely lose your balance during this test. So only perform this test in the presence of a physical therapist or a physician. So step 3, standing here with your eyes open. If you don't have an issue, typically you're fairly stable in this position. Patients who have an issue, when they close their eyes, we've now taken out the visual system and we've changed the input from the ground. So you're no longer standing on a stable surface, so your somatosensory system has to react differently. Okay? If you have a problem with your vestibular system and you can't depend on your vestibular system to compensate for losing your eyes, your visual system with your eyes closed, you will lose your balance. This is a test that we frequently do in the clinic to help classify patients who have a vestibular dysfunction or balance and unsteadiness or dizziness issue. If you have a balance issue or you're feeling dizzy, call to schedule an appointment at FTR in Joliet or call your physician to schedule an evaluation. You want to see a therapist that's trained in treating vestibular issues. Every therapist covers this in PT school, but they don't cover it as in-depth as it's needed to be covered in order to treat patients who have vestibular dysfunctions. Thank you for watching. Have a good day.